Hey, the problem's not in your set. Come on in here. Lay down on the couch. It's me, Dr. Spine. Well, guess who I'm dressed up like? To give you a hint, George Burns didn't have a beard. I'm dressed as Sigmund Freud. We're kind of celebrating some of the origins of depression's discovery and treatment. We've come a long way since Freud. Depression is a medical condition that can be treated very successfully with medication, psychotherapy, and taking action to find a role that's meaningful for you. We know that depression is very complex and often mysterious. One thing we're finding through science is that it involves problems with the brain chemistry. It affects crosstalk between neurons in the brain. These molecules that flow from nerve to nerve in the brain are called neurotransmitters. The nerves of the brain talk to one another in a soup of these molecules. Medicines, head injury, or illegal recreational drugs can really spoil the recipe. There's good news. Depression is curable. The symptoms, though, they're subtle, and you have to tease it out with the help of a practitioner. It might start with some sadness that would go on for a couple of days. It might move into a period of a couple of weeks. There might be crying spells that are hard for you to explain, or loss in your life. There may be an increase in appetite or a decrease. Sleeping could increase to the point where you're laying around all day having trouble getting out of the house. Then there's substance abuse. What's really most important is recognizing your symptoms and getting help that works. So if you're feeling sadness, you're having more and more trouble coping, or the most worrisome symptoms, feeling like hurting yourself or others, that's when you must recognize it's time to get the opinion of a mental health professional. Psychotherapy provides an opportunity to size up your symptoms, to see that you are safe, to choose medications, and directly make life changes. Antidepressant medications work very well and synergize with good psychotherapy and support from your friends and family. Antidepressants are very effective, but it does take sometimes for a few weeks to get the proper dose adjustments, and it may take a few weeks on that right dose before you get a full effect. The main thing to remember is to stick with them. Antidepressants work very well to improve brain function, relieve depression symptoms, and then many people find that they look at things in a brighter way and find that they're more productive in life. Hey, just remember, you are not alone. Up to 10% of men may experience depression in their lifetime, up to 25% of women. When you get good treatment, you understand yourself better. With medications, your mood lifts. You see possibilities in your life that you didn't have before. And you move forward with a productive life. You take a perception of life that's a lot different than it was. And you come back to look at things in a real positive and beautiful way. And you recognize all that is out there for you and your people. This is Dr. Spine saying, take much good care of yourself and those around you. Until next time, stay healthy and enjoy life.